Good afternoon, Senator Smith. My name is Cheryl Mart, and I'm a registered nurse, and I work for Texas Health Resources in Community Health. And I'm here to ask you for some support of a bill that is currently in legislation right now, which would help to provide access for behavioral health services for our mental people struggling with mental illness. Are you aware that individuals that struggle with mental illness are among the highest need and costliest patients we have in the healthcare system today?
I know there are issues with access for mental health, people with mental health
Exactly.
issues. They tend to be homeless in a much higher population. I didn't know there were higher costs associated with that.
Well, right now, being able to access care, and especially if we could help people access care through their mobile devices, through telemedicine or telehealth, that would decrease their medical costs because people with mental health illnesses generally have untreated medical care issues also. Currently, right now, there is a bill, Texas State Bill 1107, that's to enact the fact that we will allow telehealth or telemedicine for our care providers. Are you aware that the Section 111.008 of that bill says it specifically excludes mental health services from that bill?
Well, as you know, I have a very rural county. I'm very aware of that bill. I think it could offer a lot in terms of healthcare access. I'm not sure I was aware that mental health was specifically excluded from that. I'm not sure why that would be the case.
I think that that's something that I would like your support on, is if we could amend that bill so that mental health services could be part of the telemedicine or telehealth access bill that's in the state legislation right now. That would increase access for so many of our citizens by cell phone or smartphone, and be able to reduce their costs and also increase access. Can I count on your support in helping me with that?
Well, why don't you talk to my associate, Mr. Johnson? You know, he handles all of the back work and leg work for me. If you could sit down with him and go through the details, he can write me a summary, and we'll see where it goes from there.
That would be great. I will look forward to talking with him. I'll set up an appointment with him now, and I look forward to your support. And thank you for advocating for our citizens.
Well, thanks for your interest in what happens in the state of Texas. I appreciate it.
Have a great afternoon.
Bye-bye.